Welcome to the Afterspin, opinions from thought leaders in our state. I want to ask Peg O'Connell and Anna Beavon Gravely. In 2010, our state began an initiative called Healthy NC 2020, a series of 13 major health goals to be reached by 2020. Well, there's compelling evidence not only are we not going to attain our mental health goals, but our state may actually be going backwards so far as the treatment of the mentally ill, especially when you consider the number who end up in hospital emergency rooms or in jails rather than getting their help. Peg O'Connell, comment on this.
Well, Tom, just as background, the Healthy NC 2020, there was a Healthy NC 2010, 2000. So we've been tracking these major health indicators for a long, long time in North Carolina. And some we've made progress. Some others we have not. We're not as healthy as we should be. I think one of the great tragedies of our time, and not just in North Carolina, is what's happening with our mental health system. In around 2000, there was a push to close our state hospitals and move programs and resources into the communities.
Now, that was a result of a national lawsuit.
Well, it was a result of a national lawsuit, and it also seemed like a very good policy. You know, if someone is mentally ill or has behavioral health problems, it's good for them to be close to their family. It's good for them to be in a community where they're familiar and comfortable. The problem was they closed all the facilities, the state facilities, and then they didn't do much about doing things in the community. The recession hit, the 2000 recession hit, so the funding wasn't there. And then when they started to fund it, they funded crazy stuff. Like, I think everybody remembers that sort of scandal about people being paid to take somebody to the movies. So they put money in places that wasn't really a good thing. And in a lot of ways, administrative burdens have pushed private carriers and private providers out of the Medicaid system and out of the system generally. And so when you privatize all that, you don't have the stability that comes with more government.
Part of all of this was, as Peg was saying, to get it back down to the local level. The problem is that the local hospitals didn't have the psychiatrists and the mental health professionals that they needed to be able to provide this mental health. The hospitals didn't have wings that they could dedicate specifically.
Right.
So what are we going to do here? I mean, is it time to start considering opening back up state-operated mental health hospitals or whatever?
I think a lot of things can be on the table again. I think as I'm listening to this conversation and listening to Peg's answer, a lot of what seems to be shocking to me is that there's still a massive stigma around mental health illness.
That's absolutely right.
1 in 5 people suffer mental health illnesses, and until we can actually start having those conversations in the community, then we're not going to be able to address or hit any sort of metric or goal associated with an initiative.
But we can agree that confining them to emergency rooms and jail cells
for sure
is not a good.
That's not going to help them improve.
No.
Well, and you know, Tom, I mean, just this, I think I've said this before, but the largest single provider of mental health services in the United States of America is our prison system.
Yeah.
That says an awful lot. If we had, one of the things that I've been working on is closing the health insurance coverage gap. At least a third of those with behavioral and mental health issues are uninsured. If they could get access to some type of insurance, then they might be able to get to some of these private providers.
For sure, we've got to do something. We're not doing a very good job.
Yeah, because this is making me crazy.
Yeah.
I'm going to need some help.
Oh, okay. Well, while you're still here, we'll thank all of you for watching the Afterspin. We'll have more video all during the week on ncspin.com.